Hi, I'm Penny, and in this video I'm going to be sharing the story of my cancer diagnosis. And I'm sharing this in the hopes that it might be useful to you or someone you love who might be going through a similar experience. And I'm also going to try and post real-time updates on my situation as my treatment unfolds. So if that's of interest to you, then please subscribe and follow along. Anyway, let's get into the video. So I was diagnosed with breast cancer about 4 weeks ago, and how it came about is pretty unusual, I think. In the sort of 6 or 7 months preceding my diagnosis, I had been looking after my mum at the end of her life. And very sadly, my mum passed away from a very rare type of breast cancer. She had squamous cell carcinoma of the breast, which was metastasized, and it took her life very quickly. It was very aggressive and grew very rapidly, and there was nothing that could be done to help her. Although I didn't realise that during the 3 months she was in hospital. We were messed around quite a lot by the NHS. Anyway, story for another day. But my mum sadly passed away of breast cancer very recently. And when I was at the hospital visiting her, which I did every day while she was there, one of the consultants suggested to me that at my earliest convenience I should go and get checked out for breast cancer. So I sort of noted that at the time, but didn't do anything about it because I was just too busy looking after my mum. But shortly after she passed away, I went on a bit of a health kick looking after myself, and I did lots of tests that were overdue. So I went for a cervical smear test, which we're supposed to do here in the UK every 3 years or so. I did a bowel cancer test, which I had been sent in the post. And then I also arranged to go and have a mammogram and check up for breast cancer. And I arranged to have that done privately because, frankly, after everything I'd just been through with my mum and her experience in the NHS, I just couldn't quite face going to an NHS hospital. So anyway, I arranged to go privately, and I went to what's called a one-stop breast clinic. And this is the sort of thing that is run in the UK where you can go on one day, they can investigate what's going on with you, they can do lots of different types of tests, and then at the end of it you should have some kind of result. So I went along to this one-stop clinic expecting it to be relatively routine and for the results to be negative. But actually they did a mammogram and found something that looked suspicious. So immediately on the same day while I was there, they did a quick ultrasound, and then they also, with my consent, took a biopsy, which was unexpected, but I was glad that they were able to do it quite quickly all on the same day. So with the biopsy, they basically give you some local anaesthetic, insert a needle, and then extract some of the cancerous or some of the suspicious cells to see whether or not they're cancer. So we did the biopsy on that day, they sent the samples off for testing, and the results took about 10 days then to come back. And the consultant then confirmed to me my diagnosis. Now, during this time when I was waiting for the results, I was feeling quite sanguine about the whole thing and sort of taking it on the chin a bit. And I realise now I was probably in denial because at that stage it was still theoretical. But once I got the results and my consultant started speaking to me about treatment plan, then it all became very, very real. So this is my diagnosis. I have invasive ductal breast cancer, which is not the same type of breast cancer that my mum had, thankfully, because that was lethal, and this is treatable, I hope, or so it seems. So it's invasive ductal breast cancer, which is, I think, reasonably common, but the biology of it is triple negative, which is rarer. So I think about 15 to 20% of breast cancer cases are triple negative breast cancer. It is an aggressive type of breast cancer. what I have is early, it's stage 1, but it is grade 3, which means it doesn't behave like normal cells and it grows quite quickly. So it's early, which is good. It's invasive ductal breast cancer, which is a type that's treatable, which is good. It's stage 1, fantastic, but it is triple negative, which is aggressive, and grade 3, which is fast growing. And in terms of size, I will try and put an image up on screen because there's a really helpful one that I saw one of the breast cancer charities had produced. The size of it is about 32 millimeters, so 3.2 centimeters, which they tell me is what they class as a reasonable size. It's not small. So that, in a nutshell, is the type of breast cancer that I have, the diagnosis that I have. It is on the right side of my breast. I had no idea it was there before I went for this checkup. When I was sort of feeling around, I couldn't really feel anything myself. I think it's quite deep. But after the biopsy, I think it became quite angry, and now I can feel it. So I know it's there, and I can feel it's there. So in terms of my treatment plan that I've been given, I have been told that because of the type of breast cancer that I have, the best plan for me is to have chemotherapy for 6 months. And I'll talk about the type of chemotherapy I have to have in a minute. But chemotherapy for 6 months, followed by surgery, and then possibly radiotherapy, depending on the type of surgery that I have to have. And then on top of chemotherapy, surgery and radiotherapy, I'm also supposed to have immunotherapy for probably a period of a year. So the type of chemotherapy that I've been told I should have is a combination of carboplatin and paclitaxel. And the paclitaxel is supposed to be every week for 3 months. And then the carboplatin and the immunotherapy will be every 3 weeks during that 3-month period. And then in the next 3-month period, I'm going to have continuation of the immunotherapy, which is pembrolizumab. I think I'll put the name up on screen so you can see it. And then in that sort of second stage of chemotherapy, I'm going to have something called EC chemotherapy. Again, I'll put the full name up on screen. So it's 2 different types of chemotherapy following a different routine. So in the first 3 months, I'm going to have carboplatin and paclitaxel, and the paclitaxel is going to be every week, with the carboplatin and the immunotherapy every 3 weeks. And then in the second phase, I'm going to have the immunotherapy with EC chemotherapy, and that will be every 3 weeks. And then the hope is that during that 6-month period, the cancer will shrink or be eradicated, preferably. And then after that, I will still need to have surgery, even if the cancer is eradicated, because they will want to remove the tissue that was affected by it to prevent recurrence. And then as to the surgery, I'm having some further testing done to try and ascertain the likelihood of recurrence of breast cancer. So my sort of vulnerability exposure to this type of cancer. And then depending on the results of that testing, that will determine whether or not I have a lumpectomy, which is just going to remove the tissue where the cancer is, or whether I need a mastectomy or potentially even a double mastectomy, depending on my recurrence risk. So I don't know that yet. At this stage, I don't know what type of surgery I'm going to have. If I have a lumpectomy, then I will also have to have radiotherapy. If I have a mastectomy or double mastectomy, I don't think I'll need the radiotherapy. So I'm sort of waiting to hear about that. So that's sort of my diagnosis and my treatment plan in a nutshell. One of my friends asked me the other day how I'm feeling, how I'm coping with the news, and I think I am coping reasonably well, maybe a bit bizarrely well. I am ridiculously grateful that the breast cancer that I have is treatable after having seen what my mum went through. So I'm sort of hanging on to the positive of it's early and it's treatable, which is really sort of helping me to face what I have to go through with the treatment, which I think is going to be pretty grim. I also, when I got the news, I had a slightly bizarre reaction where I was really keen to see friends and family and just connect with the people that I love, even people I hadn't seen for a long time, because I didn't know how I was going to react to the treatment and when I would next be well enough to do that. And also, of course, you have your irrational fears about, well, what if it doesn't work, and, what might go wrong. But I'm not really thinking about that at the moment. I'm focusing really on the positives. I had a lovely couple of weeks where I was able to see lots of people that I love. I've got a lot of support around me. I'm feeling positive and strong mentally at the moment. I'm sure I will have low points as the journey progresses, but at the moment I'm just staying positive. I'm going to do some videos on my treatment and how it affects me, and I hope that they will be helpful to you. So if you're interested in that, subscribe, follow along. I think that's it for today, and I'll see you in the next one.